allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Well, good afternoon, evening, happy fall. Thank you for joining us. We have a lot to discuss today, so thank you all for being here. To start, if we can have everyone reviewed the minutes from our last meeting, if we can have a motion to approve those minutes.
I motion to approve.
Thank you.
Second.
Dr. Foster,
Yes.
Robin,
Yes.
Dr. Fleming,
Yes.
Kathy,
Yes.
Terry,
Yes.
and Dr. Brunt.
Yes.
Thank you.
Thank you. Our next board meeting will be on December 3rd. If we all look forward to in November, that'll be on election day. So we chose to put that one off until December 3rd. And we will move on to our new business to start with our Juvenile Services Partnership proposal. Thank you.
Good evening.
Good evening. Thank you for joining us.
Sure.
Bringing up your proposal. Yeah. Oh, the floor is yours. Okay. Yes.
My name is Allison Cox, and I am the director of the Juvenile Detention Center. This is Amy Beyer, and she's our executive director. So, on behalf of Judge Mary DeBoer and our juvenile justice system team, thank you for having us here tonight. We really appreciate that. As you already know, submitted a proposal in regards to the use of SB4 money. I don't really dive into all the numbers and all that because I know you have those in front of you. But I mean, overall, what I just wanted to point out is that just the grave importance in regards to medical services for the juvenile detention and for juvenile justice services. Just to give you a little bit of history, our building was built in 1994. And pretty much since then, we have not had any upgrades to our building in regards to medical services. And all we really have had is one nurse, and that's only been up until recently, that was on full time. That's pretty much all we have. We do have one doctor on contract that comes out one time a week for 1 hour to meet with any kiddos that have any medical needs. We distribute a ton of medications, both psychotropic and non-psychotropic medications, and that's also in your packet in regards to the numbers. One of the things that I just want to say is that between the mental health needs, the medical needs of our youth, the medication needs of our youth, the multiple special dietary needs of our youth, we are woefully understaffed in regards to care for our youth. Once they're incarcerated with us, we are their caregivers, we are their parents, and we are charged to ensure that our kids have the best possible outcomes. A lot of the kids that come through our doors, whether it's through the front door of the juvenile probation department or through the back door in the juvenile detention center, or even in the front door for our juvenile court, they really present with just a multitude of issues. We have some kids with, heart arrhythmias. I can't say that word. We have diabetics. We have kids on CPAP machines. There's kids with kidney disorders. And that's not even including all the kids with all the psychotropic, medications that present to us. So what we just really wanted to talk about is not only those needs, but also the needs for our staff. Our staff has really been hit hard in regards to a lot of different things that we never have had to face before. Amy and I have been doing this for Amy over 30 years, me close to 30 years, and just the change in regards to the mental health needs and the medication needs of these youth and their medical needs have just gone through the roof. And I don't know if we're just getting better at catching it, but once they're with us, we really do need to care for them. And not only that, but a lot of our staff members that come on board with us, let's just face it, we're criminal justice majors. Most of us, a lot of us got into this field for criminology reasons. On the other hand, I am a psych major, so I did have that mental health side. But a lot of our staff have come in through our doors to care for youth because just for the safety of the community. And once they start with us, they just realize the multitude of issues with mental health and medical that they're like, whoa. And so training is just of utmost importance for our staff as well. One of the things that I'll point out is that just the rise in kids coming through our doors with autism. We need further training for that. Right now, we do have a few, one-on-one trainings with our facility therapists that are able to help us here and there, but we really need to dive deeper into that because a lot of those kids, we also have to look at how do we want to deal with those kids when it comes to having to physically restrain them. That's a whole other ballgame. So that's just in a nutshell is some of the things that we find that's just very important that we wanted to point out to all of you in regards to this proposal. Amy, I don't know if you want to add anything?
No, you're doing a good job.
Okay. So like I said, just in a nutshell, everything's in our proposal in regards to what our needs are. What I would say is that the 24-hour, round the clock care of these youth is very much needed, especially on the medical side. It can be pretty scary situation for us in administration that we're having detention officers distribute medications to youth in evenings and weekends. Okay, because our nurse is only there 8:30 to 4:30 Monday through Friday. So that's a huge issue. So the need to up our staffing in regards to our medical needs, our training needs, as well as being able to beef up a little bit of our programs in regards to the youth that are not in our care and on the probation side while they're in the community in order to have those really good pro-social interactions with the community so they don't come through the back door to my center is very much needed.
Very good. So there's been a lot of meetings and discussions behind the scenes with our council persons, the staff, ourselves to get to this point. And so if you get to page 5 of the proposal, they did a nice job kind of laying out specifically what they're asking for monetarily and what that is all for and how that meets the criteria for our HFI funding and how we are filling those gaps with the children at the JDC. We had asked for the numbers just so that we can all have an understanding of how many children we are going to be impacting with this type of funding, and I think it's tremendous. I mean, 794 juveniles referred, 976 offenses committed. I mean, these are a lot of kids, and so this type of help can go really far. And then we did discuss through the different things that they were talking about. Incidentally, they came a time where they were shorthanded, and Jess came in and helped out in an emergent fashion for over a month. Every day, day in and day out, she was on call to serve them, and I want to commend you for doing that. Great leadership, great partnership, and just shows the value of your service and commitment to the community. But when she got involved in there, I think it helped kind of these discussions for us to have this interaction together. And, these discussions of where maybe this is a lot for one person. Maybe we can add some LPNs and increase the hours of service with skill training. And so that's where you'll see the 2 part-time LPNs and how that was developed. And as they talked about, they haven't had any upgrades in these medical offices since 1990. I don't know. And in my head, that doesn't sound that far away, but when you do
94.
like that, yeah, that was a long time ago. And then the training, I think that is also tremendous, especially when they were talking about the number of staff, 1, that they have, and 2, that need these upped trainings for autism and trauma, BLS, basic life support, all these types of things. And then the other thing is just to help the development of these children, right? To give them opportunities to feel like they're part of the community, to improve their mental health, to improve their overall health, get them involved in our community. And so that's where that all fell into play in terms of all of those different new numbers that fell down. I didn't know if you needed any opportunity to I appreciate the two of you, Councilman Graham and Councilman Vasquez, to be here. But I didn't know if you wanted anything to add.
I just wanted to say this all started firsthand in the conversation that I had with here. And I said, what do you folks think you're going to be doing with this grant money that you're going to have? And she said, well, we were doing a study about race funds. I said, well, what was the priority? She said it was transportation. And I said, oh my gosh, and it came to my mind about Porter County Aging Community Services. And they're very short on buses. And I said,
And drivers.
buy a couple buses. She said, oh, absolutely not. That's I said, well, maybe help out the part-time bus drivers. Well, possibly, but we'll have to think about it. And that came to fruition, that happened. And I just want to say how thankful we are that you're able to help in whatever way that you can. Because with us all working together, we can make our community better, our county a better place. So thank you very much for your help.
Thank you.
I happen to be liaison with JDC and the Port
Mm.
And myself and Sylvia were at a meeting with JDC and we heard some things that said, SB 4 money, maybe. All they got to do is approach the Board of Health and work with the Board of Health. But the interdepartment cooperation that we have seen in these last couple of weeks is fantastic. And I hope the rest of the county takes note. Not that you're coming to you. But the fact that they work with one another, we have a department that has 5 cars, but we're in a department, and I don't think they need them all. Maybe they can use that to maybe get rid of 2 at the quarter van. The JDC van that works both in winter and summer. In case you don't know, they have 2 vans. One doesn't have heat, one doesn't have air conditioning. I kind of joked and said, use the one with heat, winter, without air conditioning, you know, and then winter back and forth. But basically, echoing Sylvia's sentiments, we are glad as council for this county to see this type of cooperation. We really are. All we got to say is thank you very much for the whole thing.
I don't know if there's any discussion, questions.
Well, I think it makes a lot of sense going through this, step by step. You put it out very well to let us know your conditions there. And I just can't imagine the people that work there wouldn't have training in these specific cases. And it's been 20 years ago, but I was in a JDC in another city, and I saw it take down, and I just cringed at how they did it. And I'm hoping that you don't have to resort to something that drastic, but I think it would help that people be trained and know what to do and how to handle children who are having such problems. I commend you for working with them. It's a field that I would been interested in, but didn't follow through.
Thank you.
And I think, as you were saying, Allison, this not only impacts the number of children that you have on site in your services, but their families, their siblings, their parents, their schoolmates, when they go back to school, so it really has a ripple effect in the community of Porter County so that it's not just serving them on site, but I think, the way that your staff intervenes with them, the coping strategies they learn while they're there, that's really the point, right? Not just incarceration, but teaching life skills and teaching those things while they're with you. And I see this as then evolving, hopefully, with them, and then, actually rippling out into the community. So when I think about from a public health perspective, it addresses their health specific needs while they're with you, but also carries along with them, out into the community. So I really like how you broke this down into the different levels of need and how those then can be applied to the care of the children on site and then, throughout the rest of their life. So thank you for doing that.
Thank you.
I appreciate how I could tell that you're thinking, well, we probably need more here, but we really have to share it here. And our day is spent putting out acute fires, managing chronic problems, and then you have to help them integrate back into normalcy. Typically, normalcy is a relative term, but I could tell by the proposal you're trying to manage. Boy, we could really use this. So need it here. So you're trying to compromise. But in most things with healthcare now, it's just getting staff to help with, because I know what to say, I know what to prescribe, I know what he needs to do, I know what she needs to do. But just having a sort of an outline there. You guys are brave. I love it. It's thoughtful. It's thoughtful, and it has intent. And to Dr. Brun's point, it helps them integrate back into reality or a society to be functional, not just here's a this and move on. So it's just nicely laid out. I commend your work.
Thank you.
Thank you.
I wanted to get to the bringing the, I love that too. There are parts of the proposal, the pro-social things that bring people together.
Yes.
Hard parts.
And one of the things else I wanted just to say is just the wonderful time that we had meeting with the health department members and being able to talk about different programs, and it opened our eyes to what was available with you guys and what we had, and just being able to even pare it down even more because
Right. Yeah.
you guys are, well, we can do that.
Yeah.
We can do that. So it was a really great experience overall.
And then these guys, well done.
So I,
Very eye-opening.
oh, I just had a quick question. So I know, if, we approve this proposal, I'm assuming this is going to be a yearly grant that we're going to be committing to. Is that correct?
This is a very good question. So we can only commit to anything with our monies through the end of 2025, right? So next year is going to be a legislative year. The state will have to decide to invest in this funding again. So we can't really do anything outside of that. And we did have that discussion with them, and for them to know that we all need to fight for this money to continue from the state, or think of ways to continue this on through the county, however show itself to be. But with all of our partnerships, we can only really promise ourselves to the end of 2025.
I mean, what I would say if we approve this, I would be really trying to, keep track of how things are progressing and how much of a change you're seeing with the funding, so that way we can,
Well, we have to have that.
right.
With
Anyway,
anything
right.
we give our funding to, they're going to have to give us those
Sure.
numbers back, and
Okay.
so those things we've discussed as well, so
Okay.
we can continue to turn those and for those things back to the state, because with anything that we give,
Correct.
we have to give those numbers back.
Yeah.
And so they knew that we'll be asking for that
Robin, think about your sustainability.
sustainability.
Okay.
That's
Correct.
Yeah.
Yes.
Yep.
We had some pretty good conversations about our intentions to further investigate ways that we can sustain this down the road and stuff. And those are our intentions, and we hope that we're able to, formulate a plan and hopefully it'll come to fruition. But so that's our objectives, and we're hoping that we can still, whether this dries up if we're granted money and it dries up after a year or something, that we can, continue to consult with the health department, because it's just been instrumental.
Yeah, I think that's, and in the training, we even talked about the training programs that we are going to hopefully help enlist for them. They can train further trainers.
Yes.
So we train them, they'll be trained to train new trainers. So continuing that process, so the upfront training won't continue on, it's
Right.
upfront cost, but then as things move forward, it'll make more sense financially.
And some of the medical equipment, I mean, once it's purchased, then
Right.
may not need to be
Right.
Yes.
Yeah. I figured that
30 years.
already got
Why not?
Years out of
God willing.
table.
Oh, our exam tape.
Yes.
So, yeah.
I actually said we took it apart,
Uh-huh.
and because it was getting duct taped on the top, and we just bought some pleather, and I'm out there with my staple gun, and we're flipping it. Yeah, just to have it keep on going. So
And even with that conversation, we work together. We have accounts, for medical supplies that
Mhm.
help incorporate for different pricing and things like that. So it's really been a really good conversations of working together to get this in the most cost effective way, but really provide these services to these children.
Are there grants out there that cover, that might cover the services you'll need? If
In
it
reg-
rise up, I mean, after a year,
There's no indication.
No, no,
Yeah.
it won't. It's not gonna. I think they promised us this is generation.
But there are some opportunities out there that we would be able to research, for sure.
Yeah, because I can't imagine you're the only,
No, right?
you know, entity in the state that's having an issue in
Oh, right.
the juvenile department with this.
When I worked in Lake County,
Yeah.
Before I came here, in that detention center, there was four full-time staff, four full-time nurses.
Oh, really?
Yeah, and there was 3 full-time mental health therapists on staff. So, I think some of the bigger facilities definitely have more staff.
Sure.
We're not a huge facility; we're a medium-sized facility.
Gotcha.
And I think some of the smaller ones, might not even have any staff.
They don't.
They might contract them out with some of their
Gotcha.
local people. But a medium-sized facility, I think if we were, and we could certainly investigate that further too. But I think if we were to call them, I think we'd find out that they got more staff than we do. But we can only really speak to our needs, and I know that it's just every year it's just become more and more problematic. And like Allison mentioned, just if you talk about just the autistic youth that we're seeing come in, it's just tremendous the amount now, and we're frankly we're underskilled in that area. It's not something that I think most of us ever thought we'd see this number of mentally, challenged, individuals coming through the doors and stuff. So, but we've had some fragile diabetics. About 10 years ago, we had a young man that actually died in our facility, had a cardiac event in the gym, and had an undiagnosed cardiac problem that no one knew about. And we had all of our staff is certified in first aid and CPR and stuff, but we weren't able to do anything for that young man, and unfortunately he did pass. So that's always in the forefront of your mind, those what ifs when the critical incidents do happen. It's been a long time since we've had one, but it's going to happen.
Yep.
And we want to make sure that we're as prepared as possible. So.
Well, if there's no further discussion, if I would like to, if anyone could entertain a motion to approve our juvenile services partnership proposal.
I move that we accept the proposal and fund the amount presented to us
75,000, I believe.
for the juvenile detention center.
I'll second.
Dr. Lawson,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
Thank you.
Thank you.
Thank you
Thank
very
you
much.
very much.
Thank you.
Thank you.
Thank you for all that you do. All right. So next up on our new business is on-site septic appeal. It's been a minute. We've missed you.
Okay, I think Demetrius is gonna
He's so-
there. Yes.
I know, I could tell.
Cool to look at.
So
Looking at Dan.
I have Don McQuestion. He's registered soil scientist with Soil Solutions, his company, and Tanya, who did the design that is up on the screen. Do you have any questions of them?
No wonder I couldn't read it.
So the issue with this lot is they're in need of a replacement septic system on the property. There were multiple soil borings done. The issue we ran into with this property is off to the left-hand side, there is a pond or a lake. This is over in Sylvan Manor off of Route 30 here. And the area closer to the pond has fill, which you're not supposed to put a septic system in fill. But the rest of the property, due to steep slopes and very shallow till, will not support a septic system either. So realistically, there's nowhere to put a septic system on this property. It's an older house. It was built 60s, 70s, and they, the rules were different back then. So that's how they were able to get a septic system originally. So I've been out to the property. I've met Tanya and Ben McQuestion out at the site, and we were looking at areas to try to put a system and could not find anything. Up by the road, you have the 2 well radiuses, can't be within 50 feet of well. So what's been proposed is it's a Elgin sandline system, which is considered a technology needed in Indiana. What Elgin is, yes.
Sorry to interrupt you, but we're wondering where's the well? Is that what those?
Those circles are the well radiuses. Those are the 50-foot well radiuses.
Oh.
So you have the one on the lower part is the well for the house, and then the neighboring well is up at the top. So either
Neighbor's
So that's
house?
for the neighbors.
for the neighbor's house. So you have to be 50 feet from any drinking water well.
Right.
Neighbors, your own,
Okay.
everything.
They really want to be.
So
Thank you.
no problem. So what they're proposing is the reason we brought it in front of you is the code says you have to be 50 feet from a pond or a lake.
Okay.
And given the area that we can actually put a system, which is the flatter area towards the lake, we're going to be within 50 feet of that lake. So per the code, I have to deny it, but then they can appeal it to the health board and get your guys's vote.
The system that we're
It's called Elgin. It's considered a technology in Indiana. So basically what it is they use the same sand they use in a sand mound. It's Spec 23 sand. It's washed. It's rated through NDOT. And all the fines are out of it. So this sand, when you utilize it for sand mounds or for these sand line systems, if it's wet, you can't pack it together. It just crumbles back apart because you don't want those fines in there because then it sets up and then you're not going to get water movement through that sand. So they wash the fines out of it, get all the fines out of it, and then they sell it after it's been rated and everything. Then, they use it in road construction, but then it's also required for elevated sand mounds and these sand line systems, which are technologies new to Indiana. So the Elgin technology, what it is it's 4 foot by 3 foot plastic, like PVC, like modules, like they're like this big, and all the cleaning of the effluent, or the majority of it, is in these plastic modules, and they put a 4-inch pipe on top and fabric over the top. There's a manual for it. You have to be trained in it to install it and inspect it and design it, and we've all gone through the training. But so you're getting cleaner effluent going into the natural soil by going through these modules. And so what we're proposing here, and I've talked to our representative from the State Department of Health, Dave Ortel, and kind of asking him some questions. And so what we're going to do is there's 26 inches of fill there. We're going to excavate out the fill. That's going to get hauled away, and then we're going to fill that void with Spec 23 sand, and then we're going to put this Elgin system on top of it. And the issue with it is the only place we can put it is within 50 feet of this pond or lake. So we're trying to do everything we can to get the cleanest possible effluent, so we're not contaminating this pond that's behind this property. So with this Elgin modules, you're getting a cleaner effluent. And then also, if we have to, we can put a aerobic treatment unit on the system. And what that does is it goes in after your septic tank, so your solids settle out, and then the liquid portion of the sewage, the effluent, goes into this aeration unit, and it's like your own little wastewater treatment plant. So there's an aerator in there and a bubbler, and there's a filter, and actually the effluent that comes out of this is fairly clean. It's not drinkable, but it's pretty clear. And so
You put that in all at once then.
it's not we would put it in on we would put it in on this one, but it's not required on all systems. I mean, it's an additional cost
Okay.
to put this air, and you have to have a agreement with whoever installs it that comes out and they do regular inspections of it to make sure that it's working properly and everything. And they have to submit those reports to the state and also to us.
Okay.
So we're making sure that that aeration unit is working. So we have really clean effluent going out into this Elgin system, and then the Elgin modules will clean it even further before it goes into that Spec 23 sand and then kind of goes out towards the pond. So it does have drainage on it. The other thing is we did oversize the system so we get the most amount of space, square footage to treat this effluent. So normally you get a reduction on the field size, and we've actually increased the size of it and didn't do the reduction in order to maximize our capability of cleaning this effluent. You have anything to add?
I think you have it covered.
Okay.
he's
Questions?
pretty good.
What's the lifespan on one of those things?
The aerobic treatment unit or the Elgin bed?
Both.
The aerobic treatment unit, as long as it's maintained, it'll work. I mean, you might have to replace components of it, but that's what they have that agreement for, that operating agreement with whoever installs it. And an Elgin system, I mean, it's like any other system. I mean, you'll get 20, I mean, on average, we say 20, 25 years. But, I mean, if you watch what you put, especially with that aerobic treatment unit on there, I mean, that thing could last 30, 40, 50 years. I mean, because the quality of effluent that goes out there, they're actually, in some states, they allow you to direct discharge aerobic treatment units to the surface with proper permitting. So, like in Illinois, you can actually just discharge it to the surface, and it's so clean, but you have to have proper permits and everything to do that, like through, what their Indiana Department of Environmental Management would be. So we have IDEM, whatever Illinois has, you have to get NPDES permits through them to discharge to the surface. But Indiana doesn't allow you to direct discharge aerobic treatment units. It has to go into a soil absorption system.
Of course.
So in Indiana. So
Oh yeah.
As it should.
As
Two quick questions.
yes.
The pond, how big is it, and how many properties does it affect outside of here?
There are houses that surround the property on like all sides. I don't have an exact count.
How big is it?
It's a decent sized pond or lake.
Be a couple-
Bigger than that, I would think.
Oh yeah.
It's a fairly good size pond.
And all the houses around the pond have septic systems?
Yes,
okay. Well,
and they were all older systems.
they're gonna all come.
So they're all
Aid to this? Or?
well. This one, because of the steep slopes and this shallow till, until we do soil borings on the other properties, I don't know. They might have space to put in a system where they don't have to come in front of the board. It's just this is a special case where we're kind of limited because the only other option without putting the system down there is they don't have a functioning septic system. They have to vacate the house. I mean, that's our only recourse here.
So you said you were making it larger than necessary?
Yes.
That was creating the encroachment on the water then, the pond?
No, even if we did the reduction, it was still going to encroach on the pond, just given where this flat area, because we're doing an above ground system because we have to, and above ground systems can't go on greater than 6% slope. And if you look at the topography,
Honestly.
the slopes behind the house are great. You couldn't even put an in-ground system on those slopes because in-ground systems can't go on greater than 15% slope. So those are probably 18, 20% slopes, maybe greater.
Yeah, even steeper, close to 30%.
30%? Okay. Yeah. So, I mean, that's where their current system is on those steep slopes. But again, it was put in the 60s and there wasn't a rule. It was more of a guidance document. And, the rules are stricter now than they were, back then. So, we're trying to not have to have them vacate the house. And so we're trying everything we can to get the cleanest possible effluent into this system so we're not contaminating the lake
Right.
as well.
Been involved in great detail.
I've been involved, and I've also consulted with the state on this to kind of get their take on, what we should do.
Do you think this is the best way moving forward?
I think it's really the only option we have. And we're taking as many steps as we can to make sure we're not going to contaminate that lake with effluent, with sewage and E. coli. So, everything I'm seeing here, I've looked it over and everything, and with the aerobic treatment unit and this Elgin technology, I think we're going to get about as good as we're going to get with this with cleaning the effluent.
And then you'll monitor for the need of that secondary.
Yeah, and they're gonna do the secondary. They're gonna do the whoever installs this is gonna have to do a maintenance agreement. They're gonna have to sign a contract with the homeowner and whoever installs it, and they do like it's twice a year or 3 times a year. They go out there and they make sure the blower's working, that the filter's working, and everything is going functioning properly. So we're getting that cleaner effluent going out into the system.
Do we have any other systems like that in this county?
There's a number of systems that have aerobic treatment units on them. There's some in Liberty Lakes off of 100 North. We have some throughout the county. There's a few in Whitethorn Woods off of 6, and there's a lot of them up in the dunes, like Ogden Dunes and Beverly Shores, because
That would make sense.
the code says if you're within your septic system has to be 200 feet away from a drinking water source, and Lake Mission is a drinking water source. So their septic field has to be 200 feet away. And a lot of those properties are within that 200 foot. So what the code says is if you put an aerobic treatment unit on your septic system, you only have to be 50 feet away from the high water mark of Lake Michigan.
Mm-hmm.
So we have a lot of them up in Ogden Dunes where we had to put aerobic treatment units on so they could get a septic system in. So on the lake side. So yeah, and they've been around. I mean, aerobic treatment units have been around since before I started. They were kind of new when I first started here, and there's a number of companies that do different that have different technology stuff, and they all have to be state approved. So they have to use a state approved aerobic treatment unit, and everything's approved by the state.
Thank you.
Well, without any further discussion, if all are in agreement to entertain a motion to approve this on-site septic appeal on the 162 Moreland Drive, Valparaiso property.
A motion to approve.
Second.
Thank you.
Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Cadby,
Yes.
Dr. Rosana,
Yes.
Terry.
Yes.
Thank you.
Thank you.
Beautiful.
Thank you.
Good luck.
Yes. Absolutely. Job well done.
So next
Okay.
on our agenda would be our legal services agreement with
Blatchley, Tabor, Bosick, and Hartman, which is Dave's firm. His firm is up for renewal for contract services. I think we were all sent the details of the contract. If there's any questions or concerns, I will start with saying that we've given you today. I think Carrie sent. I saw an email go through of all the different contracts through the course of the last year that we've been working on. The basic, regular, everyday ones, along with the new things that we've had to discuss. The health officer, all these things. So we've put a lot on your plate this year, and we appreciate.
But that's a very nice problem to have, because in the 50 years I've been doing this, public health took a back seat to a lot of things, and it isn't anymore. And the fact that I've got a little more work to accomplish that, it's well worth the effort for what we're doing for the citizens of Porter County.
Thank you. And even while you couldn't be with us, you had excellent backup from the firm. So
Well, that's
it was seamless without any issue, and for that I'm extremely grateful and thankful.
Yes.
So if there's no further discussion, if we can have a motion to approve the legal services agreement with Blatchley, Tabor, Bosick, and Hartman.
I'll motion to approve.
I'll second.
Okay. Dr. Dawson?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Yes.
Dr. Rosan?
Yes.
Terry?
Yes.
Put my DA. It's habit. Okay.
Thank you. It's a pleasure to work with our staff, and it has been a 50-year ride.
That's
Alarm.
insane.
It's hard to believe.
50 more.
Well, the level of knowledge that you've accumulated over the course of that time is definitely apparent.
Imagine.
Okay, old business. Porter County on-site sewage system ordinance. This has been an ongoing.
Now, I told him.
This is
Come on, Dan.
Here we go. We've been waiting for this for like a year. I
and that's true. It's been an
No, it's-
experiment, perpetual motion, but every minute's been worth it, because the other approach would be to have this would be on your third try to approve something that we'd send down and get sent back. So Dan's been
you've done a lot of work. I
conscientious
know you have.
enough to
I've rewritten this thing like 5 or 6
I
times
know you have.
because they keep sending me a different draft document
Oh,
because they keep making changes to it. So
got to keep your head on a swivel.
This is it.
Is
No
this
more
the final?
changes.
We hope.
it's been an ordeal.
I'm just here to say I'm glad you understand it all.
I know. We appreciate you.
Yeah.
All right, well, fill us in.
So last year there was legislation passed, went in effect July 1st. Basically, one of the main things that came out of it, which was there was multiple things that came out of it. One of the main things was we used to be able to be more strict than the state code. Now we can no longer be more strict than the state code. So basically, anything we had in place prior to July of last year got wiped out by this legislation. So we had installer registration, that's gone. We used to have lot size criteria, that's gone. So, but they put an avenue in to get some of those things active again by going through. What we have to do is we have to write an ordinance, we have to get it approved locally, and then we have to submit it to the technical review panel at the state. And there's people on the technical review panel from the state, from local health departments, soil scientists, building, just a number of different entities that are involved in this that sit on this panel. They have representation, and then they will read over the ordinance and they vote on it, and if it gets approved, then we can enact it. If it doesn't get approved, then they would send changes back and we would make changes. And it started off where I was trying to get everything that we had in before, but the legislator who had written this law, he sits in on the panel even though he's not on the panel, and he says, nope, we're not going to approve that. So I've kind of gone, that's why we had so many different drafts, because the state came out with a draft document to kind of guide us on what to write, and then stuff got chopped out of it. And so they would send me another one, and more stuff got chopped out of it. So unfortunately, basically, when I got this last draft to kind of modify and everything, I talked to the state, and they had blanks where to put in the county name, and I'm kind of getting the idea this is like fill in your county name and then submit it to us, and then we're done. And she's like, yeah, you kind of hit the nail on the head, because a lot of the stuff, the more stringent stuff, wasn't getting through the TRP. So I tried my best on this. I tried to incorporate everything that we possibly could, try to get installer registration back, because I think that's in here. There's some things in here about we can now say, like, if a residence is within 300 feet of sewer, we can kind of try to get them on sewer as opposed to putting in a soil absorption field. One of the other things that came out with this legislation, and it was actually went in effect in May of last year, was they allow for permanent holding tanks now. So you can just put a tank in on a residential or commercial property, and that's it. And you just get it pumped out as it's full. And they put some stipulations on that, like the tank size can't exceed 10,000 square feet. You got to put an alarm in there so the alarm sounds when the tank is full. They have to have a contract with a licensed wastewater hauler and submit it to the state, or submit it to us. And then all the pumping receipts have to be submitted to us every time they have the tank pumped. And then they said the local health department can create any other, specifications on this, because they didn't say what kind of tank they had to use. So honestly, if we don't specify what tank, 55-gallon drum, I guess, works. I don't know. So I have stuff in here saying it has to be a state approved tank. And so there's some stipulations in here. There's part of it is also creating an operating permit, because if we issue an operating permit on these, then that'll help us keep track of them, and we can revoke that permit if they're not maintaining these holding tanks. So that's something that I have to work with Dave to create, and there'll be fees associated with that. And the other thing is with the aerobic treatment units, like I talked before, we're supposed to be issuing operating permits on those, and we've never had an operating permit. So I'm going to create one for those aerobic treatment units that will put into effect as well. Other things that are in here is I did put in that lots have to be at least an acre. Not an acre usable like we had, but just an acre. So we're not going to get these really tiny lots trying to put septics on and everything. Because this legislation doesn't just affect us, it's any city, town. So if a town or like Beverly Shores had rules on their books concerning septics that were stricter than the state, those are null and void now. I mean, it wasn't just health departments, it's any government entity can't, dictate anything stricter than the state code. So other things I had in here was just like general stuff, like we want 3 soil borings on a property, which is what we required before. I just put it in the ordinance so it's there in writing as part of the ordinance. So that's some of this. Something else that is in here is like connection and reconnection to an existing system. That's something that we run into a lot, where someone tears down a 2-bedroom house, builds a 5-bedroom house, and wants to tie on to the existing septic system, which isn't sized for a 5-bedroom house. So there's some criteria in here, like if we've permitted it and we have a file on it, then and we can review it, that's one thing. Or they would have to have it inspected and come up with a plan to maintain it. And then there's some things in here about voluntary versus involuntary. So like if the house gets taken out by a fire or a tornado, we can use best judgment to kind of determine if they can tie back on, because realistically they didn't tear it down because they wanted to. It was because of an involuntary action. But if someone wants to tear down the house and build a new one, then it says you got to install a septic that meets the most current code. So that's most of what's in here. That's pretty much all that's in here.
The way this works is then we have to present this to the
commissioner.
Well,
so we're on the schedule for, if it passes tonight.
Yes.
We'll be on the schedule for next week for first reading, and then the second reading would be end of October. Okay. And then hopefully if it goes through first and second reading, I can get it approved in November at the TRP meeting in November. I have an email out to Ellis Quinn with the state asking what I need to submit along with the ordinance to the TRP for review. And I also had Ellis review this before I brought it to you guys, and I had Dave review it.
Yeah.
And Ellis said it should make it through the TRP the way it's written. There was a few minor changes that I had to tweak, but it should make it through, she said.
Nice.
So,
yes,
okay.
I've reviewed it and I agree with Dan's analysis, and because of his diligence in front of this process, once the commissioners approve it, it should have some pretty easy sailing through the state.
Yeah, and my plan is to start the installer registration stuff at the beginning of the year. So we'll send out applications again and stuff. It's just this past month, I haven't been able to register them because of the legislation, because it's more the current code doesn't address installer registration. So that's why it got wiped out.
So the installer registration is so you keep track of who's authorized
Yeah.
to do that.
Yeah, we had an ordinance that said if you do any septic work in Porter County, you had to be certified and registered, and they would get certified through Indiana On-Site Wastewater Professionals Association, and that's a third party. It's but they would give a test over the state code, and then they would have to give their certification, and they would have to pay a fee and proof of insurance in order to register. That's going to remain pretty much the same, but Amanda, who is the administrator in LaPorte County, she's kind of working on coming up with a test that they can give, and I'm going to work with her with that. And we're going to share the test, so then we don't have to send our installers and stuff downstate or something to take the IOPA test. They can still take the IOPA test, but then they could also take our test, because a lot of our guys work year round, and it's hard for them to not work. You take 3 days off to go downstate to take a class and a test. So we're going to offer a test in conjunction with LaPorte County. I've already had discussions with her on that.
Well, I know several years ago we had one fly-by-night guy who would come and do a crappy job.
Yeah, he was doing things without permits.
Yeah, no pun intended.
Yeah.
Stuff. So yeah, it was. That's part of the reason for the installer registration, just because everyone's on a level playing field. You don't have someone coming in and saying, "Oh, I'll do it for super cheap," and then they don't get permits and all that. So
they're on down.
Yeah, it gives us some teeth to go after them if we catch them doing that. So
very good.
Good.
Well, if there's no further discussion, if we could have a motion to approve the Porter County on-site sewage system ordinance that you've worked so diligently on.
Motion to approve.
Second.
Thank you. Yes.
Dr. Brunt,
Yes.
Dr. Clement,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Rosan,
Yes.
Terry.
Yes.
Motion. Thank you so much.
For your hard work.
Honestly, it's been a labor of love. All right, so next the report of our board attorney in regards to finalizing our search for a new health officer.
As we are all aware of, our current health officer, long ago that maybe she would have liked, announced that
January.
in January that what she said is she'd stick around as long as it took to deal with the replacement. I don't think any of us thought that would be
October.
We're sitting here in October and we're still in the process of doing that, but it's culminated in a very diligent effort by everyone on the board, and specifically our chairperson and Carrie, and whittling down, and we have determined that we are prepared, and this is again a matter that needs to go to the Board of County Commissioners in addition to you, but I think we are prepared tonight to recommend the name of an individual who we believe will be able, as difficult as it may be, to fill the shoes that our current one has. He seems intrigued and really serious and deep in his commitment to public health. And so we would like you to publicly this evening approve the referral of his name to the Board of County Commissioners. And we are on that meeting on the 8th as well to get their approval. I don't know whether Carrie or Doctor wants to make any comments about the process or the name we've come up with.
So our applicant's name is Dr. Rodney Guimont, MD. He is a local family physician who is from Chesterton. So I'm particularly excited that we have someone who's interested, who's from our community, who has a family in this community, raising his children in this community, is aware of the needs and resources available to our community. He has a long-standing, over a decade history of working in Northwest Indiana. He was the medical director of our urgent care that then in Chesterton that then during COVID got closed down. He continues to work with utilization management, other clinics and reviews of nurse practitioner care. He has a long-standing history of being involved in public, well, not so much in public health, but just involved in improving the health in his community. He talked about even some missionary work that he had participated in. And really just in my experience in speaking to people about him, I didn't know him, but some of the board members do, just his genuine care of his patients and those in his community. And I've heard nothing but positive remarks in regards to him. I didn't know if any of you who knew him had anything to contribute.
I agree. That's for 10 years when he was able to help with patient care. It was, thank you, he's available, he does a good job, very thoughtful. I know his family, the children are responsible, kind, good-hearted. It's very, yeah, he's fine.
Yes.
He's a solid guy.
I don't know, Terry, if you had any, I know you knew him as well.
Yes, like Dr. Fleming, I totally agree. He's just a very kind man. Just really a good guy, all around good guy, and committed to the community.
Yeah.
He's deeply about children.
A lot invested in the community, and that always helps.
Right.
And Carrie and I would bring up different things and different parameters of things that we think need improvement, and he was just like, yes, I'd love to be able to do this. I'd love to be able to add on and keep going with the programs that we have, and even excited about developing new programs in the future. So we sat and waited for a long time. I have to say I was pretty nervous that we had no one for the longest time. So I'm so thrilled that he decided to take this application forward.
He's also rational, easy
Yeah,
to talk
level.
to,
Yeah.
and to pivot when needs to pivot or take criticism. It's constructive. Just one of those people. It's easy to work with. Common sense.
And my interpretation of him, and it's just mine, like he just is interested in giving back. Like, you don't come into public health, millionaire. So he's so interested in helping and being involved. Yeah, and flexible.
I obviously did not know him before I met him.
I didn't.
And just speaking to the ease of talking and the way that we get along already has really impressed me. He also has experience with working as a manager of people.
Yes.
But I never thought that I would meet somebody who is as thoughtful as Dr. Stamp. Really kind of like took things in and thought about them before responding. But I feel as though it's very similar in that way.
Mm-hmm.
And so
I agree.
we're just very pleased with our ease of
Optimistic.
I had just one question. With our hiring protocol, do we do a background check on them?
We did that before we gave to you.
Okay, I was just curious.
Yeah.
And is that like a criminal or just like a full background check that we actually do?
Criminal to the extent that we can. That's difficult if there had been any criminal convictions outside of Indiana, but that was pretty highly improbable.
I'm just like wanting to make sure before we go before the commission.
Before we came to you,
yes,
we had we have a pre-meeting kind of a thing to talk to.
I figured we did, but I was just like trying to like make sure when we go forth that we're like not having anything that comes before us. So okay,
I
Well, if there is inclination to do so, Madam Chairperson, it would be appropriate for you to entertain a motion that the name of our candidate be referred to the Board of County Commissioners for their acquiescence in his appointment as the new Porter County Health Officer, with that occurring at their meeting scheduled for October 8th.
I submit a motion to approve Dr. Rodney Guimont as to be moving forward to the commissioners in search of our health officer position. For Phyllis.
Yes.
Dr. Bunce.
Yes.
Mia,
Dr. Brunt.
Yes.
Dr. Fleming.
yes.
Robin.
Yes.
Kathy.
Yes.
Dr. Rosan.
No, I mean yes. I couldn't help myself.
Yes.
Was that a slip of the tongue or a change of your mind?
You guys are cracking me up.
I would say yes all night. Somebody had to be.
Somebody's
This does that once.
Just to see what you
Just to make sure that everyone's
let
awake.
let the record show that he voted.
You're welcome.
Yeah, my fault.
Egg me on.
The motion is approved. Thank you. Well, these are exciting times. Big shoes to fill.
When is
Yeah.
that? Oh, great.
So it's next Tuesday. No, all of the commissioner meetings are in the
They
morning.
meet in the morning,
So it's 10 a.m.
10 a.m.
Okay,
Prime time.
So I have to take off.
sorry.
Yeah,
Yeah.
I know. Yeah.
Thank you.
You're welcome. Awesome. Very good. So we move forward on to our claims and receipts, which should have made its way around
Yes.
and back. So if we can have a motion to approve claims and receipts.
Motion to approve.
Thank you.
I'll second.
Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Rodman,
Yes.
Kathy,
Yes.
Dr. Rosenbaum,
Yes.
Terry.
Yes.
Very good. Reports of committee staff and health. Carrie, I'll let you start.
I didn't have really anything new to add tonight. I want to thank you for you guys got a lot accomplished tonight. This
Yeah, it's a lot.
and just kind of the start of our October meetings. I did want to let everyone know that our budget, we did have our second reading of the budget.
It was a 3-hour-long meeting over there.
As we were last, our last.
Oh, lovely.
We did
Sorry.
very pleased at 8:30 on Friday night. All of our budget was approved on second reading.
Yay.
So thank you all for all the hard work on that as well. So, as always, I can't express how much we appreciate your support of each and every one of the divisions in the department. We just really appreciate you. And if you have any questions from any of the reports, I know a lot of the things are all in those reports now. We spent quite a bit of time with this tonight, but if you have any questions about anything at any time,
I just want to bring to light, and I actually had her print them out to hand to you guys as well. The Porter County Council of Aging, they've done a summary of the rides that they've performed in 2023 and what we've done so far in 2024, and it's really interesting to see since how much they've increased the amount of rides. Over the course of the last few months, and that's exactly the types of things that we were looking to see. Just in August, the year before was 1,200 rides, and then this year they had over 1,700 rides, so that's 500 more. Yeah, and so I was really excited in such a short amount of time. I don't remember exactly when we voted for that to already see that level of improvement. So there we are with all of that. So thank you for presenting that to us and keeping track of those things so diligently. And I am thankful to see such a quick improvement in the services that we can offer as a county.
and we approved that right away when their buses broke. So they
Oh.
drivers, they were training them on one of the buses.
So we can't take that negative against us then. Darn it. Okay. Yeah, so thank you. Thank you for all of the reports.
I like the report on the bicycle.
I
too.
Yeah.
It's interesting to read. Yeah.
I've heard a lot of feedback from community members regarding that, and we still continue. I do giving references to the Lyft services. I think with everything, we still struggle with that connect of the community being aware of the programs that exist, and so to make that connection, even for our JDC when they were here and they discussed the need of rides and such, and to let them be aware if the parent is available, then we have these Lyft services. They can call us and have Carrie Honeycutt help get set up. So it all continues.
And I apologize because I said I wasn't going to talk very much, but I do want to let everybody know that a couple of things we have. Carrie is making, and I think it was in my report, the cards for her services to make sure that we're getting them out to all the providers, to all the clinics, urgent cares, so that people know. Also, we are live with our screening services agreement West Health, so maybe it meets the criteria, general criteria for screening. It's not diagnostic. We refer to her for those. Jamie has also done a lot of work meeting with the schools, and she's had requests from her letters to meet with schools. The training for our asthma program is complete, and so she's got flyers for those. We're meeting with Mobile Integrated Health to let them know about that program. And things, the information is starting to get out. Carrie is getting different calls, Jamie's getting different calls about things, all of our departments about things that they're hearing about, things that we're doing. So just the other day, Carrie got a call about a student at a school who has a bike, but was in need of a helmet to ensure, and so she was able to accommodate and go and fitting and give bicycle safety and those kinds of things. And so those are just
And even the car seat, if you can bring up that, like how you've done more of that too. I heard there was a good story lately.
Yeah, we've done a lot of them, and in a way, car seats are from the lead state to car seats that they'll be giving us to get out, and then like the girls, the nurses at the hospital on the OB floor, they bring them sometimes to help moms that are having.
And they don't have a car seat, and here they are, you know.
They're expensive.
They
They
used to
are.
give you a car seat when
I don't,
they not do that anymore.
no, they don't anymore. They used to, yeah. So now they are available to do that. So I think, and I mean, I know you were called in at the drop of the hat, went over there and tried to find one, get it to the mom, and I appreciate that.
That's awesome.
Very
They would.
Yeah. All right. Any other additions? All right. If we can, motion to adjourn. Meet again in December. Oh, sorry. Do we have public comment? I didn't even. Yeah. Yes. Well, fine. I'll give you 4 minutes.
The timer starts.
Quite actually, I think you'll hear me. Quite actually, my public comment is one thing that myself and Councilperson Graham were curious about is the septic system for the hauling away. Is that for existing that you have to have a contract under, or is that only new? When you for septic system hauler to take away your waste, your solid waste.
Well, I mean,
You have to have a contract if you already have an existing.
no, this would be only for if you're having a permanent holding tank. You don't have to have a contract for an existing system.
Okay.
You just hire someone to pump it out.
Basically, only for new then.
Well, it would
No.
only be for new that has a permanent holding.
Okay.
You have no field after your tank. It's just a
The
tank.
tank.
And then they would come and pump it out as it got full.
Okay.
Honestly, I've done the math on what it costs to pump a tank and how often you have to pump it if you're living in a house full time, and it's not cost effective to do a holding tank. And when I did the math, it's like $250 to $300 to pump a tank, and if you're doing laundry
Okay.
in the house, on a holding tank, you're gonna pump it 2 or 3 times a week, and it's gonna cost you like $47.
Oh my Lord.
So it's good for like seasonal homes, like if you're up in the dunes and you have a seasonal home. You can do a holding tank.
Even that, I would like a gamble to.
Those of us with a septic field, we're good.
You recommend every 2 to 5 years.
You're right.
Yeah. No kidding. Yeah. My office.
That's all. Thank you.
Thank
Thank
you.
you.
No, thank you.
Thanks, Dan.
Any other public comment? All right. Motion to adjourn.
I move to adjourn.
Yes. All in favor?
Yes.
All right. We'll see.
Time is meeting Tuesday,
Next 10 a.m.
10 a.m.
Our next meeting till